culturally sensitive mentor is a mentor who is aware of the other culture and can also empathize and show that empathy towards the other person, which is a student in such case. So cultural sensitive mentor can help student to integrate into, for example, Finnish culture and help the student to function better in patient care, for example, in teamwork here in Finland. So it means also that mentor takes the role as being cultural sensitive by introducing student to this culture and showing to the student how to act, for example, in a teamwork, what kind of rules are kept here in the unit where they take clinical practice. So cultural sensitivity can be also like cultural intermediator. Mentor takes the role of helping student to integrate into the clinical practice. A culturally sensitive mentor can be a mentor who welcomes student and creates this kind of culturally accepting atmosphere in the unit when the student arrives to the new clinical practice. Mentor can take this role of being culturally sensitive by introducing student to other teammates and telling them a little bit already before the student comes from what kind of culture person comes and a bit about the background. And culturally sensitive mentor is also a mentor who can take a little bit of time to get to know the student and ask from student where they come from, to recognize the student's background. It also requires certain flexibility and acceptance from the mentor. However, mentors are extremely busy in the unit and they don't always have time to chat and discuss about their different cultures. But it can also break certain walls between the student and mentor and help the student to integrate easy into the teamwork. So mentors sometimes think that they need to be very acceptant of different kind of cultures. It's not always that way. Mentors are responsible of the student's behavior as well. So it is important that mentor is open and honest and tells the student what is required of the student, but always has that cultural sensitivity within itself, remembering that this person has a different background, cultural background. For example, mentor can tell the student that in Finland it's very important to keep certain schedules, and it's very important and respectful to come to your work shift in time so that other colleagues can go home. This is one example, and that doesn't mean that mentor needs to tolerate any kind of different cultural behaviors. As well as in patient, for example, private care, if the patient wants its own privacy when taking bath, it's important to tell to the student that in Finland we treat patients certain way and this is acceptable this way in here. And it can also be good to ask from the student, how is it done in your country? What do you think? In that way you can build a discussion about cultural diversity with the student.